Good morning. I'm Thomas. I'm an associate professor at the Center for Health Informatics and Technology. So I'm a software engineer by training. Yes, thank you, Nikos, for inviting me into Driven. As an engineer, I really value cross-disciplinary work, and that's a lot of the things that sort of guide us as engineers when we try to build solutions. And that's essentially a part of my research domain and interest as well. How do we build information technology that aids people achieving their goals? I do my research mainly within health information systems and clinical decision support. So how do we ensure that healthcare professionals have access to the information that they need when they need it, and that they can actually make good and valuable judgments and treatments based on their available data. So in this domain we have sort of this mix, this social, cultural, organizational mix, of course, of humans and technology, where this cocktail really needs to click in order for them to achieve their goals. And sometimes it doesn't really click that much. We frequently hear stories about IT problems. And even I swear at my computer from time to time, of course. But of course, when there's human lives at the stake, again, when things aren't working as they're supposed to, and that might be due to a number of reasons, of course, but particularly within the design phase of these artifacts, if things are not captured correctly there and we don't really understand what it is we're trying to build towards those who depend upon the systems that we build. So I guess I was actually a little bit uncertain about how to phrase my research interests to this group, because I'm number one and today. But anywho, technology-mediated behavior change spurs from a challenge I faced as an engineer in my research as well, where we spend a lot of time building systems and then it doesn't really get accepted and put into use. Because we rely on changes to working procedures, to organizational culture, to loads of different things that really needs to be addressed when designing technology. And frankly, we don't always think of that in due time. Yeah. So then I've also worked with engagement and retention in e-health programs together with Susanne over there. Yeah. So you'll hear about Susanne's research later, but worked on how we design platforms for use in internet-based treatment. So, but also we've been working with various providers of such platforms in order to help them understand how to engage and retain their users. I have a background in computer gaming as well, where our daily challenge was, of course, how do we get people to pay for our products, and how do we make sure that they come back and do the same thing again tomorrow. And essentially it's the same challenge with how do we ensure that patients adhere to the treatment, and how can we again build tools that assist the care providers in providing the best possible treatment for these patients. And one of the things that we do in this regard is, of course, to involve people ourselves, but also other domain experts, but in particular also the end users. So for instance, again, the patients through, assume many of you know participatory design, but user-centered design as well, which actually also, in my mind, is closely related to this notion of engagement and motivation, because if we can ensure that people are engaged in the creation of the platforms and the technology that they are going to depend upon, first of all, I think that we get better products, but we will also get, hopefully, something that has a high degree of ownership amongst those who are going to use it when we put it into sort of real-life scenarios. Right? I think we've also seen that this co-creation process can actually also serve as an intervention because it engages and it motivates the participants in this design phase. And I think it can be used as a way to actually also, doesn't perhaps scale very well, but at least engaging people in co-creation and participatory design aids in their own treatment. Yes, so those are my research interests. And then collaborative visions, I'm not sure. But I actually stumbled across a book last year from Jan Gehl. I don't know if any of you know him, but he's an architect who focuses on designing city landscapes. And this currently inspires me quite a lot, because Jan has defined a number of principles that influence how we engage as inhabitants and as citizens in a city. And the design can affect our behavior. It can open up, it can close, it can direct, it can hinder. And in the same sense, we say that information technology does the same thing. So I'm hoping that I can provide some assistance for some of our research projects here as well, and how we can build sort of sensible systems that catalyze engagement in whatever context that we're trying to provide this system. Sort of like deriving the same architectural principles that Jan works with for cities. Of course, what I've mainly have been working with is the healthcare system, but essentially this is also a rather large system. So there's plenty of problems to be addressed there, and we really need better systems within the healthcare sector. So deriving system design guidelines for integrating and implementing these systems is pretty important as well. Could say that right now we're also doing a project where we are following the implementation of the new electronic health record systems in the region of southern Denmark and northern Denmark as well. And this is a system that is absolutely essential for clinicians to do their work, but it's also really a system that causes a lot of, I know maybe you've heard of Sundhedsplatformen, right? Sometimes things don't go necessarily as smooth as you think. And so again, how do we design systems that work?